Today, we also will have a specially invited guest joining us. We have a new segment this evening, and all the information that's going to be shared will be addressing questions we know you definitely have as a result of the vaccine rollout launch that took place yesterday. Before we begin this evening's program, we are going to have the Minister of Health address, the address delivered by Dr. Akil and Byron Nisbet recently. We're going to have a rebroadcast of that, and once we come back, we'll get right into the program, so don't touch that dial.
Fellow citizens and residents, on Thursday, 18th February 2021, while making a statement in the House of Assembly, Dr. the Honorable Timothy Harris, Prime Minister and lead head on health matters in CARICOM, informed the Federation that the National Vaccination Plan in response to COVID-19 pandemic will begin rollout on Monday, 22nd February 2021. The Honorable Prime Minister also indicated that the Federation received a donation of the Oxford AstraZeneca vaccine, and we expect to receive additional supplies of over 50,000 doses through our procurement from the COVAX facility and other humanitarian donations. As Minister of Health, I am pleased to follow up on Prime Minister Harris's declaration regarding the rollout of the country's vaccination plan. I am delighted to note that St Kitts and Nevis continues to be proactive in its efforts to manage COVID-19 as the pandemic wreaks devastating toll on communities globally. I wish to take this opportunity to commend all our citizens and residents who have been complying with the non-pharmaceutical protocols advocated by our healthcare team to combat the virus. Indeed, as a small island developing state, we have been able to protect our citizens and successfully prevent COVID-19 related mortality with our limited tools and resources, an all-of-society approach, and certainly in the true spirit of community, to the extent that St. Kitts and Nevis has become a model country relative to the management of COVID-19. Fellow citizens, I am pleased to state that the vaccine is here, and we are ready to roll it out. The fact that there are safe and efficacious vaccines is indeed indicative of one of the greatest public health achievements in human history. As a critical health resource to protect the vulnerable, save lives, and reduce the burden of the virus on our health systems, the St. Kitts and Nevis vaccine plan will be rolled out under the auspices of the National Immunization Committee of the Ministry of Health, who relied on the well-established National Vaccine Program with its best practice measures, relevant input from regional and international partners such as PAHO, WHO, and the Strategic Advisory Group of Experts on Immunization. The plan consists of the following key elements: a governance structure for planning and coordination, a vaccine delivery infrastructure and supply chain, an evidence-based approach to decision-making, a system for ethical and equitable access to vaccination, an appropriate legal and regulatory framework for vaccine deployment, a robust education and communication strategy, a mechanism for capturing vaccination data in timely manner, a monitoring mechanism for adverse reaction and effects, and post-marketing studies on effectiveness and impact. The plan will be executed utilizing a three-phased approach, and the main goals are to 1. Mitigate against death and serious disease, 2. Promote maximal functioning of society, and 3. Reduce the burden of COVID-19 on vulnerable persons. The overall aim of our country's plan is to ultimately access adequate amounts of COVID-19 vaccines to consequently vaccinate at least 70% of our population to achieve an appropriate herd immunity threshold. This media presentation, therefore, is a follow-up to the Prime Minister's announcement as part of the robust COVID-19 Vaccine Awareness Campaign by the Ministry of Health to provide more specific information regarding the national rollout of the vaccine commencing Monday, 22nd February 2021. The key points of the country's vaccination implementation plan are as follows. The vaccine will be administered to persons 18 to 80 years of age. Persons over 80 years of age will be required to be evaluated by their physicians prior to receiving the vaccine. Vaccine information brochures can be found on the covid.gov.kn website or on the social media pages of both St Kitts and Nevis health promotion units. Persons can also collect brochures at the community health centers and the administrative office of the Ministry of Health at Bladen's Development. Administration of the vaccine will be based on an appointment system. Persons who are interested in being vaccinated may call the health hotline 311 or visit the nearest health center to make an appointment. Once the first dose of the vaccine is given, persons will be issued with a COVID-19 vaccination record card and an appointment to return in 10 weeks for the second dose of the vaccine. Additional information regarding the vaccines and the vaccination process will be disseminated to the public via various modes of communication as part of the ministry's awareness campaign. The following health centers will be used for the initial rollout of the phase 1 of the vaccine. On St. Kitts, Newtown, Basse-Terre, Sandy Point, and Tabernacle Health Centers, and on Nevis, Charlestown, Gingerland, and Combermere Health Centers. During the subsequent phases, all 11 community health centers in St. Kitts and 6 in Nevis will be utilized for vaccination. Please take note that the following categories of personnel who fall into the first phase and who will be vaccinated during this first phase starting Monday, 22nd February 2021 are as follows. Healthcare workers, those who work in high to very high risks such as specialists, internists, doctors and nurses on the COVID-19 ward, operating theater, intensive care unit, accident and emergency, COVID-19 testers, health center nurses, managers and assistants, and emergency medical services personnel. Older adults ages 60 to 79 years with chronic diseases and 2 or more comorbidities. Border protection staff along the corridor of containment, which includes port health, immigration, customs, ground transportation, including taxi drivers, hotel workers at front desks, security, and lobby. Please note that we are also going to reserve an emergency amount of vaccine just in the event that there may be an outbreak or response mitigation required. To initiate our vaccination rollout and awareness campaign, the general public should kindly note that at 1 p.m. on Monday, 22nd February, the Ministry of Health will launch the national rollout of its AstraZeneca Oxford vaccine at the Newtown Health Center, Ponce Pasture, St. Kitts. During the launch, persons representing a cross-section of Stage 1, including members of Parliament, will be inoculated with the vaccine. Everyone is asked to tune in or view the launch, which will be aired and televised via various media houses in St. Kitts and Nevis. I urge you, citizens, to come forward and demonstrate your love of self and country and facilitate the return to a sense and state of normalcy by being vaccinated. I submit this is the best and safest way to combat the virus and mitigate against the dire consequences and impact of its transmission. Our individual and collective action would certainly alleviate the pressure exerted on our healthcare and frontline workers relative to the virus. Finally, as we embark on our vaccination rollout, I ask you not to be complacent, but to maintain continued vigilance and adherence to the public health measures we have adopted thus far, in our quest for a stronger and more resilient and safer health sector, and by extension, a safer Federation of St. Kitts and Nevis. Thank you, and may God continue to bless us all.
In your formative years, we were there. When you got the good news and the bad, we were right there with you. Through all your great adventures, we were always right by your side. Now that life has thrown us a curveball, we are still here. And as we navigate this difficult period, the SKCCU will continue to be there for you and your family to help you through. We will assist you in safely and efficiently accessing your funds through our digital platforms, online banking, mobile banking, ATMs, and even our drive-through services. We can get through this together with responsible financial decisions by making food and medication a priority, practicing proper hygiene, maintaining social distancing, and constant prayer.
We're here for you.
We're still here.
We will get through this together.
SKCCU will continue to be your financial partner for life.
I will take the vaccine because building defenses against COVID-19 is a team effort, and we are all a key part of that defense.
I definitely will be taking the vaccine when it's my turn.
I will be taking the vaccine as it is an important tool in the fight against the pandemic.
It is important for me to vaccinate to ensure that if I do become infected with the disease, it can prevent hospitalization. In addition, it also helps with herd immunity.
I will take the vaccine to protect myself, my loved ones, my clients, my co-workers, my community.
St. Kitts and Nevis, why do we need to vaccinate? Kenisha? So we can jab COVID-19 away.
Welcome back to Leadership Matters. My name is Jacqueline Bryan and I will be your host this evening. Leadership Matters airs every Tuesday right here on ZIZ at 8 p.m. and the program is held by Prime Minister Dr. the Honorable Timothy Harris, who uses the medium to share updates with you of national interest and also to hear from you about your concerns and any feedback you might have. This evening, he's going to be joined by very special people. As you may know, yesterday, Monday, February 22nd, thousands watched live the launch of the COVID-19 vaccination rollout. Our guests this evening will be able to speak to you much more about this initiative and answer any questions you might have about the vaccine. And they have also taken the vaccine themselves if you have any questions about that. I was told at the start of the program, I referred to Honorable Akila Baron Nisbet as Dr. Akila Baron Nisbet, so that was an error on my part. However, once I begin to introduce our guests, you might understand why. We are joined this evening by Permanent Secretary in the Ministry of Health, Dr. Dolores Stapleton Harris. We are also joined by the Chief Medical Officer, also in the Ministry of Health, Dr. Laws, as well as Medical Chief of Staff at the General Hospital, Dr. Cameron Wilkinson. We also have a special segment this evening, during which we will be speaking with His Excellency Dr. Didacus Jules, who is the Director General of the Organization of Eastern Caribbean States, or the OECS. He will be joining us via a live link from St. Lucia. So, yes, I'm surrounded by doctors this evening, and I got a little carried away. We are going to begin our program with opening presentations. We will begin with the presentation from the Prime Minister. then the Permanent Secretary, followed by the Medical Chief of Staff and the Chief Medical Officer. So without further ado, we'll hear now from Prime Minister Dr. the Honorable Timothy Harris.
Thank you very much, Jackie. My fellow citizens and residents and well-wishers, it is good to be back on this week Leadership Matters. This is a popular interactive public education forum that engages constructively with our people on the big issues affecting their lives and livelihoods. Our aim is to educate, inform, and assist our people to play a meaningful role in the future development of our country, St Kitts and Nevis. We also aim to learn from you and shape public policies based on your constructive feedback. The big issue for this week is the rollout of our vaccination program. Yesterday, February the 22nd, we commenced the historic rollout of a national vaccination program at the Newtown Health Center. We are now at a critical stage of the implementation of the final element of our four-pronged strategy to keep our country safe and restore it to normalcy in a safe and sustainable way. Yesterday, I was so proud to see so many persons volunteering to take the vaccine. We had members of the cabinet, doctors, nurses, the clergy, diplomatic corps, etc., being part of this watershed event. We have begun the process of immunizing our citizens and residents against COVID-19. In doing so, it is our expectation that we would achieve herd immunity so that our country can safely resume to, quote-unquote, a normal way of life. When we vaccinate enough of our population, we achieve our goal of reaching what the medical fraternity refers to as herd immunity, or what is sometimes called population immunity. This is the indirect protection from an infectious disease that happens when a population is immune, either through vaccination or through previous infection. In the case of the coronavirus disease, the scientific community has estimated that herd immunity comes when between 70 to 90% of the population receive vaccines. It is therefore extremely important that we in St Kitts and Nevis and in the region achieve this goal. No one should be left behind. Everyone should be interested in protecting him or herself from the dangerous consequences of COVID-19. Several members of my cabinet and I volunteered to be part of the first batch of persons to be vaccinated. We have been assured by our team of medical experts that they have taken all precautions to ensure a successful vaccine rollout for our citizens and residents. Yesterday, I'm advised, around 70 persons participated in this pilot rollout. Today and every work day, our citizens and residents are encouraged to go to the relevant health centers or to call our national hotline 311 to get the appointment to be vaccinated. Let me at this time remind our citizens and residents that the health centers that will be used for the first phase of the vaccine rollout are in St. Kitts, Newtown, Barstair, Sandy Point, and Tabernacle Health Centers, and on the island of Nevis, the Charlestown, Gingerland, and Combermere Health Centers. You may ask the question, why vaccination? And there are several good reasons why it is important to be vaccinated, some of which are as follows. One, it is always important to take responsibility for your health. When you vaccinate, you protect yourself from the worst effects of COVID-19 and you strengthen your immune system to fight COVID-19. This responsibility must extend to our families, our communities, and indeed to our country. We avoid the risks of overwhelming our health system with consequential deaths and life-threatening scenarios. Another reason why we should vaccinate is that vaccination would help us to put thousands back to work, especially in areas of high contact, such as our hotels, restaurants, taxi and tour operation subsectors. Finally, we put our economy and by extension our country back to a state of near normalcy through this vaccination program. By that I mean we help put the country on the path firstly of recovery and growth. We experienced 5 years of consistent growth annually from 2015 to 2019 until COVID-19 came. During the vaccination process, it is important for us to be reminded that the COVID-19 related protocols that we have been following must be maintained. Hence, I strongly urge our citizens and residents in St Kitts and Nevis to continue to take this virus seriously. In doing so, we must always remember the importance of wearing our masks properly, hand sanitizing, and practicing social and physical distancing. It is important to note that one of the reasons we have been successful thus far in our approach is our Life First strategy, which is the core element of our COVID-19 response. I take this opportunity to thank the citizens and residents of this beautiful Federation of St Kitts and Nevis for embracing our all-of-society approach and for their compliance and cooperation over the last 11 months in the fight against COVID-19. Your patience, stamina, and understanding have contributed to our international standing as a very low-risk jurisdiction as it relates to COVID-19. I urge you now to continue being vigilant. Do not drop your guard. We all should continue to exercise caution in what we do and how we behave if we are to win this battle. We must remain focused and disciplined and continue to fully adhere to the protocols outlined by our health professionals. This watershed moment in the history of St Kitts and Nevis's health system and our economy and country will long be remembered. I will remember the fortitude, the courage and patriotism of many of our citizens like Dr. Cameron Wilkinson, Dr. Hazel Laws, Mr. Abdia Samuel, and all other frontline leaders and workers like Commissioner Hilroy Brandy, the Defense Force Commander Anthony Comrie, my cabinet colleague. I single out the Ministry of Health and the Attorney General, the Chamber of Industry and Commerce, the clergy, the Immigration Department, all of whom, during a period of global and national crisis, stood tall and did all in their power to ensure a most robust and effective response. 11 months since our first COVID-19 cases, we have been fighting the good fight. It has not been a relay. It has been more like a marathon session. Other countries over time let down their guard with disastrous consequences. We in St Kitts and Nevis held strain. The prayers, the stamina and resilience of our people inspired me as Prime Minister to face a global pandemic of the type the world has never seen, and we as a people responded in an orderly and successful manner. We did this together. I consoled myself in the certain knowledge that my God, who had taken me this far, would not forsake me, and the government and people of St. Kitts and Nevis he selected me to lead. Now that we can see the light near the end of the tunnel, let us take the vaccination shot. Do not get weary in well-doing. Do not be like the doubting Thomases, being swayed here and there by every wind of false doctrine and misinformation. Our health team and task force have both advised my government and the people of this country very well. We are all alive today to tell the tale. With such a meaningful experience, we can make St Kitts and Nevis, this country we all love, the model country in holding off COVID-19, containing it, achieving herd immunity, and returning our beloved land to near normalcy. This, of course, will be a wonderful achievement. This will be a beautiful history, which we, the people of St Kitts and Nevis, would have choreographed about how, when united as a people, we can fight and defeat an invisible and deadly virus that turned our world upside down. As your national leader, I encourage you to take advantage of the free vaccines. It costs you nothing, yet it will do you and your family a lot of good. So encourage all your friends, your loved ones, your co-workers and teammates to register for the vaccine. When in doubt, my advice is to consult your doctor, our medical personnel, and follow up on all public education programs. In this regard, and in keeping with our all-of-society approach, I want to thank the task force for collaborating with Ross University in a massive public education program on vaccines held today, I'm advised, at the Ross University Auditorium. I gather near 100 participants drawn from the private sector and wider civil society entities participated. More power to them. St Kitts and Nevis has a highly commendable record in mass vaccination. Many of us are alive because of this. A number of vaccination programs come readily to mind: measles, mumps and rubella, diphtheria, whooping cough and tetanus, yellow fever, hepatitis, inactivated polio, oral polio vaccine, DPT, influenza, human papilloma virus. All these vaccination programs and more have helped us to have a very outstanding record in healthcare delivery. They have helped us as a people to live fuller and happier lives. We must now add the COVID-19 vaccine to our list. In anticipation of the highest voluntary acceptance of the COVID-19 vaccine in modern times, my government has over 41,600 doses of Oxford AstraZeneca vaccines on order, with delivery expected over the coming weeks. We are bringing them in and making them available free of cost to every persons eligible to receive them. We thank the COVAX facility and all benefactors like the governments of Dominica, India, Taiwan, etc., who have been helping us. I am happy to report that we have, through the OECS Commission, made charter flight arrangements to bring 125,000 doses of vaccines by the most direct route from India to St. Lucia, where individual distribution will be made via the RSS as soon as the charter arrives. I was informed this evening that the expected arrival of the charter is on or about February 26, 2021. The expectation is that the RSS plane will be in St. Lucia, awaiting the arrival of the charter plane coming from India. The cost of the charter is US $250,000, or just about $680,000. This cost will be met by the Eastern Caribbean Central Bank. I have, as chairman of the ECCB Monetary Council, advised Governor Antoine to release the funds with the approval of members of the Monetary Council. Additionally, 21,600 doses are expected via the COVAX facility shortly thereafter. In sum, over 41,600 vaccines will be available shortly, in addition to the 2,000 we had in stock and with which we started our vaccination rollout. We are calling on developed countries to ensure that the COVAX facility delivers on its mandate for equitable distribution of the vaccines. Developed countries should avoid the temptation to grab vaccines for their nationals alone. We are not free of COVID-19 unless all countries are free of it. We support India's massive vaccine assistance to developing countries, and I call on all G7 countries to follow suit. I am privileged tonight to have three panelists who have been at the forefront of the government's efforts to defeat COVID-19 and the rollout of our vaccination program. I thank each of them for yeoman's service today to our people and country. The three panelists are Dr. Dolores Stapleton Harris, Permanent Secretary in the Ministry of Health, Dr. Hazel Laws, our Chief Medical Officer, and Dr. Cameron Wilkinson, Medical Chief of Staff. We are fortunate tonight to have with us also, joining us virtually, a diplomat in the service to the OECS region, Dr. Didacus Jules. Dr. Jules is passionate about quality service to our region, and I welcome his perspective and virtual participation all the way from St. Lucia. Thank you very much for viewing this program. We value your feedback, and I look forward to hearing from you tonight. May God continue to bless the wonderful people of St. Kitts and Nevis, and to bless and prosper our beautiful country. Thank you.
And thank you very much, Prime Minister. We now hear from Permanent Secretary in the Ministry of Health, Dr. Dolores Stapleton Harris.
Thank you. Good evening to everyone viewing listening to this presentation. I am indeed honored and humbled to be part of tonight's discussion with our illustrious Prime Minister and my esteemed colleagues. Prime Minister, I thank you for the invitation. Since January 2020, when it became evident that the dreaded coronavirus was being transmitted globally, we did not wait until it reached our shores to begin our preparations to combat it. Prior to its arrival at our shores, we began a robust education program on the viral disease for all levels of healthcare workers and procured essential resources. We were continually informed by the science about the evolving COVID-19 disease and considered the advice of authoritative sources such as the World Health Organization and PAHO, and CARPHA, as well as the CDC. And later in March 2020, when the virus was declared a pandemic by the WHO, and St. Kitts and Nevis recorded its first case, the Federation was fairly well prepared to combat the challenge. With the assistance of PAHO, we developed a strategic preparedness and response plan to the COVID-19, with the overall goals being to mitigate outbreaks and transmission, to protect the vulnerable populations, and to minimize the impact of the pandemic on our health systems and socio-economic activities. The Ministry's Health Emergency Operating Center, which had been established previously from funds from the immediate past budget, and which also included our emergency 311 hotline, was commissioned and became the hub for the ministry to contain the virus. We basically restructured our health sector at both the primary and tertiary level to provide the required infrastructure to contain the virus. And I dare say we did so successfully. We encouraged, and at this juncture, I wish to publicly commend all our residents and citizens who have been complying with the non-pharmaceutical protocols, including frequent hand washing, meticulous respiratory hygiene, consistent wearing of masks, and physical and social distances as advocated by our healthcare team to combat the virus, as the Federation awaited a safe vaccine. I wish to also commend the staff of the Ministry of Health, particularly the members of the HEOC and other frontline health workers, for their dedication, bravery in managing the virus thus far. It is clear that the Ministry of Health has demonstrated strong resilience and commitment in its combat of the virus, with only minimal cases of COVID-19 and no related mortality or death. I thank everyone sincerely. Truly, many opportunities arose from the pandemic. Two main ones are that we have become a more resilient people, and the other, there is now the added capacity and capability for RT-PCR testing through our main JNF hospital laboratory. The polymerase chain reaction PCR gold standard test for COVID-19, now required by many global powers who are now modeling our protocols. And fellow citizens, we also now have the COVID-19 vaccine, the Oxford AstraZeneca Covishield, and are in the process of vaccination rollout, which is the main focus of tonight's presentation. The Honorable Prime Minister announced last week that the Federation has received a significant donation of the Oxford AstraZeneca vaccine, and we expect to receive additional supplies through our procurement from the COVAX facility, other supply platforms, and generous benefactors. Consequently, we launched our national COVID-19 vaccination rollout yesterday, Monday the 22nd February, which was extremely successful and included a broad-based cross-section of key personnel. And while we would have recorded a successful launch, of significance is the fact that full and effective implementation of our plan will rely on a good governance structure, given the range of responsibilities, personnel, and the responsiveness that will be demanded as the program rolls out. In fact, we recognize the need to augment and support existing structures for the implementation of the COVID-19 vaccination program. In the public health system, a vaccination program mitigates against morbidity and mortality